Good morning, everybody. Thumbs up if you can hear me. Well, it's a new year, new transitions. Willard is probably sleeping in this morning and probably going to play golf later. And so we'll just think of him in spirit. And as you know, Julie and I will continue to be in this role. And then we welcome Malia Honda to our clinical leadership teams. Malia, how was your weekend?
Hi, good morning, everybody. I did not sleep in because I'm in Hawaii and it's 6 o'clock in the morning here. So yay. My weekend was good. I wanted to wish everyone a happy new year. I've been in Hawaii for the week and New Year's being a big celebration here for those of you who know the tradition. It's a lot of big fireworks, family, food. The whole island kind of explodes with thousands of fireworks on New Year's Eve. And it's just a kind of a palpable time of reflection and closure for the year that has just passed, and hope and nourishment for the year to come. And then on January 2nd, I got super sick with some combination of febrile upper respiratory infection and no voice. So this is the first day I've actually been able to talk probably since the new year, which gave me a lot more time for reflection and less talking. But anyway, I think it's just a nice reminder of some of the obstacles that we still have to overcome, like COVID and RSV and flu. And maybe that's some sort of symbolism in it. But I had, on the first, we went to the Shinto shrine to get our New Year's blessing, and mine was excellent this year, which is something that we always cross our fingers for. So I looked at that yesterday when Kelvin asked me to take over the reflection for the morning, and it says, for the illness part, just have a strong will and you will get better. So I'm sitting with that and hoping that that is the case for the new year. And wishing you all Hau'oli Makahikiko, which is Happy New Year in Hawaiian. Back to you, Kelvin.
Thanks, Malia. Very nice of her to join us as she's recovering from her illness. One thing for you all to think about as we continue to say Happy New Year to each other is, when is the latest date that you can actually say Happy New Year to somebody without, sounding lame? And so I say January 31st. So, but think about that, because somebody kept asking me, when is the latest time I can say Happy New Year to somebody without sounding ridiculous? But welcome, Happy New Year to everybody. I wanted to give you all two things today: clinical updates, and then we're going to have some organizational updates as well. So first one would be clinical updates. I'm gonna share screen right now. As you remember, we say goodbye to our web portal. So anytime you click on the web portal, it's going to lead you to our new intranet, okay? Also known as the Open Door Company Hub. So every time you go on web portal, it will just lead you there. And so as you can see, when you go on to our intranet, I like to call it, go on to clinical and operational resources, and it will have all of our clinical guidelines and such right there. So I want to share with you two things. The first one is, if you scroll down, it's all alphabetized along with the date it was last updated. So you all can be aware, and we try to keep the hyperlink the same. And so the things I want to bring your attention to is, as we work on diabetes as the last QI focus, this one now we're focusing on hypertension. And so if you click on hypertension algorithms, it will lead you to this very, very handy dandy 11-page algorithms. Okay, and this is why it's important for our clinician, is because when Chris and Malia did their lunch and learn about a couple of years ago, we talked about dual therapy, using two different medications to better control hypertension. That's one of our big QI focus. And so we are of course, standardizing this into an algorithm. So let your medical providers know when you click on that, it'll go through the common things. And keep in mind, this is on non-pregnant adults. For pediatric, it's very different game. And for pregnant patients, they're also a different game as well. It tells you what you should be using as first line, depending on if you have any comorbidities, whether you have kidney problem, diabetes, heart problem, and such. And so this is a basic thing. It also tells you how to properly take a blood pressure at home versus in the office. If you continue scrolling down, it also talks to you about how to diagnose. And then when you have to deal with resistant or uncontrolled hypertension, there's secondary hypertension as well. Very, very busy, but if you click on certain things, it actually will discuss in details the different various diagnostic tests. And then the guidelines on, depending on age and comorbidity, what is the goal for us to be doing. And then finally, you always want to start with lifestyle modifications before you go to pharmacological interventions. It also lets you know about the different etiologies, different medication that can give people high blood pressure, along with what happens with target organ damage. And the really different risk factors. We always want to focus on people with higher risk factors for cardiovascular disease and such. And finally, we're going to work on our congestive heart failure algorithm as the next thing. So that in itself is the hypertension algorithm. That's going to be for the new year, our QI focus, especially with peer review as well. The next one is just another update is with our pharyngitis algorithm. We just updated last month, and what we did that's different is just we remove out the STI section since we have a specific STI algorithm as well. So go here for the acute pharyngitis algorithm for that. And last thing, I want to remind everybody again that during respiratory season, that's flu, RSV, COVID, remember to only order diagnostic tests if it's going to change your management, since the treatment for flu, COVID, and RSV is usually supportive care. There's a recent study that just came out on Paxlovid to see the effectiveness of Paxlovid against COVID. And right now, now that we have more information on that, it's actually not that effective as we thought, which fits in everything that we've learned, right? If you all remember 10 years ago, we thought Tamiflu was going to be the big thing with, when it comes to the treatment of flu, and it turns out it wasn't as big of an effectiveness as we had thought. So now with a lot of medical treatment, as people gaining immunity and we're getting used to this, we too know that certain things that was effective a year, 2 years ago might not be as effective now that we have a bigger populations to do randomized control studies on. So just keep that in mind. If the treatment is supportive care, is getting diagnostic tests going to change much, especially since our cepheid supply is dwindling down and we're probably not going to replenish this. So if people want to test for PCR COVID or for RSV, they're going to have to send it out to public health. So that right there is some updates on our clinical algorithms with hypertension, pharyngitis, and respiratory illnesses. I want to let folks know a reminder for RSV. Remember that with RSV, there is an RSV vaccine for pregnant patients that we currently have right now. That's the Pfizer RSV vaccine known as Bristol. It's available at NPS and RPS for our pregnant patients between the 32 and 36 weeks gestational age during RSV season. We are not carrying the RSV for 60 plus right now, but a lot of my patients and yours have probably gotten it at their local pharmacy, so they can go there. Monoclonal antibody against RSV, that's nirsevimab. Remember that is approved for babies under 8 months old. During RSV season, we had some supply issues. It is now available to VFC. Make sure the sites that are having pediatric patients, make sure you are ordering these, the nirsevimab, the monoclonal antibody for your high-risk patients. When there was a shortage, we were prioritizing for patients under 8 months with high risk or comorbidities. Now the supply chain should be improving again, so make sure your sites are ordering them to give them out to our patients that are under 8 months during RSV season. And of course, Carol Lee and the QI team had emailed you all that list to make sure you are focusing on those patients. And then a reminder, babies born to mothers who already got the RSV vaccine when they were pregnant do not need to get the nirsevimab. You don't need to do both. If the mother has already gotten the vaccine, the kid does not need to get the monoclonal antibody. That's double the coverage that they do not need. Okay, so that's clinical update. let's move on to the organizational update. Since it's the new year, lots of things happening that I want to bring your attention to. The first one has to do with the one click. And that is what the site medical directors and the ASDs have been discussing. In order to provide better access to our patients, in order to make it easier for our providers when they're managing their inbox to connect with the patient through either a telephone or a video visits, we have rolled out one click where it makes it easier for the medical providers to start a visit whenever they can. So Sarah Ross, you want to give us an update on what's happening with one click?
Yeah, we met with the administrative site directors last week. And for the month of January, we want to make sure that every single provider has an opportunity to get elbow support with an EMR specialist who's been trained in one click. And we learn again and again the importance of actually having someone sit with you when you do the visit so that you can get that elbow support in real time. So we've asked the administrative site directors to help make sure that every provider has been assessed and has an opportunity to connect with a specialist and get that support, which may take a little orchestration because providers are super busy and the EMR site specialist, there's only one per site. So we're asking that the leadership teams make that a priority for the month of January so we can start February making sure that all providers know how to do one click and when the appropriate time would be to use it. And Tammy's team is putting together some data on which providers have used one click to help guide your process of getting to the providers who likely need it the most based on the limited number of one clicks they've done. Tammy, do you have anything you'd want to add to that?
No, you did a great job, but I do have a copy of the report if you want to see it.
Wonderful. So we can send that out maybe with the notes, Kelvin, and then we can also share it with the ASDs. Great. Thank you.
And just keep in mind with one click, this is just another tool for most of us who are doing inbox stuff, when during our admin time or during our clinic. This is another way for us to create a visit without having to involve other people. Some other people don't even use one click because they're actually quite efficient in their workflow. But I just want to remind folks, this is just another tool for people to use. And if you don't use it, you'll lose it. So please use the month of January, like Sarah Ross mentioned, to practice it out and then to have the site specialist on hand to give elbow support if needed. The next one is
Kelvin, Tammy, is it easy to share one screen share of the site base? Maybe we can just take a quick look at that.
Sure.
Okay, while Tammy is doing that, I want to give people we'll circle back to you, Tammy. We'll move on to the next one right now. Oh, she's pretty fast, so there we go.
I had it up.
So this is just when we were doing the rollout from December. These are the people who have been involved in this. This isn't show the list because we wanted to pilot first to make sure we work out all the kinks. And as you can see here, Dustin and Malia have been, and Chris as well have been trying out to make sure that we figure out to make it as easy and as effective as possible. And so for other people, let's encourage your the ASD and the site medical director, make sure you discuss with your providers and then see if there's any challenges or things that we can do to support to improve the access to that. So thanks for the information there. Next one is as we continue to learn and make sure that we have availability, our learning department has working on the 2024 training calendar so people at least know for 2024 when they're supposed to do peer review, when is the upcoming training, so this way we don't conflict. The goal is to make sure that we minimize blocking clinics and at the same time not having everybody out at once. So I'm going to share screen and then Trisha can discuss more about that.
Good morning, everyone. Happy New Year. It's still okay to say. So we took a couple considerations into planning for 2024. This is the second year that we'll be working with Path Forward around the diversity, equity, and inclusion trainings. We have 3 remaining. We are most likely have a meeting this week with them, going to focus these trainings more on managers and supervisors than the entire staff, understanding that I think at this point we have at least a baseline of understanding around this topic and really building the skill and confidence of managers to navigate conversations and situations that may come up in becoming a Debbie organization. So you can see right now we have those keyed at February, May, and August. And as Calvin said, this is a draft. I'm hoping within the next 2 weeks to get this solid. So just kind of things may move a little bit, but this is the general structure. The other big thing that will be happening this year, as folks know, we've been working to change our HR, finance, and payroll system, which is called Workday. So right now we're working with the Workday folks to solidify what that rollout will be. Right now it's looking like we'll have a go live for certain aspects of the applications in April and then in July. So what that means is then the bulk of the training for staff will happen in the month preceding. So you can see we've got Workday training in March with the go live in April, and then Workday training in June with the go live in July. The other consideration is we wanted to give folks more time to complete their compliance training. So it wasn't this very high intense focus. So we've spread compliance out over 4 months. So it'll kick off in April and then close out at the end of July. And then the learning team will send out monthly reports to managers, letting them know the progress of their staff. And then lastly, for performance, from our lessons learned over the last couple of years, we are going to extend that period as well. So September will really be focused on everyone across the organization completing their self-review, and for managers to start sending their stakeholder feedback and hopefully getting that back in the month of September, allowing then time in October and November to complete their reviews, of course, with the wiggle room of December to tie that all up. And then we've also included the peer review dates. So that'll be for medical behavioral health providers. And so those dates are on there. So again, I'll be sending out the final training calendar in the next couple weeks.
Thanks, Trisha. And just to add on to that, peer review is for medical, dental, and behavioral health. And the reason why, and this is still a draft, so, but it's probably going to be like 90% accurate. We just wanted to make sure we let you know. A few things also to add on is it's our HRSA visit. It's probably going to be sometime this summer. And that's the reason why we wanted to make sure that we complete the our compliance requirement before they come, which they're probably going to come. HRSA is probably going to come in August and September. This is our every 2 years HRSA site visit to make sure that we are in compliance with that. The other thing to let folks know as well is in the past, when we did compliance, we did this, it's usually in a very, very short amount of time. So it feels rushed. We have to like, for example, the average employee had to spend 4 hours doing that. I've touched base with our compliance team to make sure that we are doing just the modules that are required by HRSA. So they are continuously reviewing that. And then so instead of doing it 4 hours at a chunk of a time, which seems very rushed, and at the same time, it affects a lot of access to patients, that's why we're rolling this out over a 4-month period. So if the average employee has to do 4 hours of training, if we plan it right, they only have to do 1 month in April, 1 hour in April, 1 hour in May, 1 hour in June, and 1 hour in July, which seems a little bit more swallowable and less disruptive to our clinic flow. Same thing like Trisha mentions with our performance review as well. And so this is taking the feedback and what we've learned in previous years to make it easier and less disruptive and more convenient for all of our staff and providers as well. So Trisha will share that once it's finalized in the next couple of weeks. Speaking of peer review, as you can see, the next peer review is in like 2 weeks, January 22nd to February 2nd. So letting folks know for medical providers, so our ASD and our site medical directors, for our medical providers, this does not include locums. This does not include our residents. Our medical providers will be doing their peer review during their admin time, okay? And then for medical providers who also do OB, Emma will lead the RPS and NPS team during their allotted provider meeting for that. For dental and behavioral health providers, once again, not including locums and our residents, the process for dental and BH will be the same as the previous one. Since they do not get admin time, the ASD will block an hour of their time so they can do their peer review. So that's the peer review. I'll work with the compliance team right now to finalize the list, and then Malia will send out the updated questions for the medical folks. Carter and Heather have worked with the compliance team to finalize the dental and BH peer review questions. The other update to letting folks know is the Arcata Clinic, Arcata Community Health Center. It was slated to open this week, technically tomorrow, but due to licensure and our addresses is getting delayed. We're hoping to for it to open in 2 weeks on January 22nd, but right now it is being delayed due to licensing issues. The other thing is PTO and holiday policy updates. You can see Michelle Clancy's email from last Friday. It is going to be effective starting today. Basically, when I read it, the two main points is all employees, number one, must exhaust their PTO before they can request unpaid time off. And the second one is holiday pay will be based on the employee's regular schedule hours for observed holiday instead of just FTE in previous years. So you can refer to our email from Friday for further details. Regarding the ASD and site medical directors, our retreat, which was originally slated for March 20th, please, if you haven't done so, complete the doodle pool, because we're changing the date. And so we'll send out the dates, the new dates soon after everybody has completed their doodle pool. And of course, our next meeting will once again be the first Monday of the month. So that will be February 5th. So let's recap. Number one, go to the intranet for the clinical updates, especially with the algorithm, hypertension, pharyngitis. And I think Mia added into, there's a search tool with our new intranet. That's why we did the new intranet. Click on the search tool, click on referrals, because there's some updated information with referrals, which is always constantly being observed and monitored. RSV, make sure we have the RSV vaccine right now for the sites that are doing that are seeing pediatric patient. Make sure that you are ordering the nirsevimab, which is the monoclonal antibody against RSV that is indicated for babies less than 8 months during RSV season. And of course, if the mom got the RSV vaccine while she's pregnant, the baby does not need to get the monoclonal antibody. Sarah Ross, review the one-click. Trisha, review the 2024 training calendar. And then ASD, make sure you follow the peer review, which is for January 22nd to February 2nd. You don't need to do anything for the medical providers, but you do need to adjust the dental and behavioral health providers. Remember, peer review does not include locums or any of our residents. That's our dental, APC, and FM residents, since they are being monitored all the time. The Arcata Clinic opening is getting delayed a bit. And then the PTO and holiday policy updates. Look at Michelle Clancy's email from Friday for more details. Okay, with that in mind, I wish you all a very happy new year, a good January, and then we'll see you on. Have a good week, everybody.